Alrighty, let's get started. So, welcome everyone to our Tuesdays at 10. If this is your first time, my name is Rachel. I am one of the educators at Professional Beauty Solutions. And each month, the education team bring you guys hour-long webinar on various different topics just for you guys to really explore and learn about various different things. We've had things on how to treat acne, how to treat rosacea. We've done topics on consultations and the missing link in consultations. So we bring you a variety of different topics. If you ever want to re-watch these, you can do that as well. If you go onto our website or onto PBS Skin or PBS Profit Advantage, you'll find them on there as well for you to re-watch whenever you want to. So welcome, welcome. Now, today's topic is going to be on how to treat scars. So I find this a really, really interesting topic. Don't know about all you guys. We're going to learn about scarring, about identifying different types of scarring, about what we can treat, what we can't treat, how we would treat it using the modalities that we have in clinic. We'll go through different topical skincare that's really beneficial for fading and minimizing scarring. We're really going to delve into wound healing and that wound healing process because it's really important for us to know the background behind that before we do go in and start treating scars. And yeah, so I'm really looking forward to today. I also really like interaction, so it's not just me here talking the whole time. If you guys have any questions, please share them with the group. If you pop it into the chat box below, just make sure that you click reply to everybody because the question you're probably thinking, someone else is thinking as well, and I love to share those answers. So let's get started and get into scarring. As I am going through this, I would be really, really interested to know, everyone out there, what is the most common type of scar that you guys see in your clinics and in your salons? All righty. So scars are a natural part of the body's healing process after injury. When the skin is injured, the body works really quickly to repair the damaged area and to prevent infection. And this involves the formation of new tissue to replace the damaged tissue. So the body then produces collagen, which is a protein that then divides and strengthens the skin and the skin structure. I'm going to be tongue-tied all today. I'm sorry. I'm only on my second coffee. Now, during the healing process, fibroblasts generate large amounts of collagen to really close up that wound. The body prioritizes rapid closure of the wound to really protect it against external aggravators and aggressors and to stop from further injury and from further infection as well. Now, this often results in the formation of scars and scar tissue, which is different from normal skin tissue. In normal skin, collagen fibers are arranged in like a basket weave pattern. In scar tissue, these collagen fibers are aligned in a singular direction rather than multi-crossed and multi-directional. So this means that the scar is a lot less flexible than the normal skin, and it's a lot more noticeable as well. Scar tissue as well does not contain sweat glands or hair follicles, which also affects the appearance and the function of the skin in that area. Scars can be a range of red, pink, or darker than the surrounding skin color. And over time, they do usually become paler. The texture of the scar tissue is often different to that of the normal skin, either being raised or being sunken. So really important when we're treating scars is to learn about the wound healing process and how that actually happens. Now, the wound healing process is a really complex and dynamic series of events that can be divided into 4 overlapping stages. You've got your homeostasis, you've got your inflammatory, You've got your proliferation and your maturation or your remodeling stage. Now, in real time, these stages do overlap. It's not just cut and dry with each stages. So they do overlap. And the entire process can take up to 2 years for the skin to fully remodel. In the next few slides, we are really going to break down what each of these stages are and what's going on in a little bit more detail. So hemostasis is our first stage. So hemo meaning blood and stasis meaning standing still is the term of how the body stops the bleeding. And rather than it just being a singular process, hemostasis stage can actually be broken into further several stages, which we're going to go through. So the hemostasis stage is the body's immediate response to injury, be it that an injury that we've caused through microneedling or RF-assisted microneedling, or an injury because they've popped a pimple or they've scratched themselves or they've fallen over. So this is what our body does. So it's an immediate response to an injury, and the aim is to stop the bleeding and begin the repair process. Now, this capability is essential to keep you alive. If we didn't have it, we would not be here. And it's particularly significant with injuries and larger injuries. So in the hemostasis, the first thing that we see is vasoconstriction. So this is constriction of the damaged blood vessels in the area, and this happens immediately after injury. The blood vessels constrict to reduce that blood flow to the affected area, and it's going to help to minimize blood loss. We then get a temporary platelet plug formation. So platelets, which are small little red blood cells, rush to the site of injury and they adhere to the exposed collagen in the damaged blood vessel walls, and they become activated. These activated platelets release chemical signals to attract and recruit more platelets to that site, and it forms a temporary platelet plug. And that clot works really like a cork on a cork bottle or a bottle stopper, keeping the blood in and the debris and germs and bacteria out. Then we get a coagulation cascade. So the platelet plug is the first step to stop the bleeding, but it isn't this stable enough to stay in place without help. So the next step is, which is going to stabilize that platelet plug, is a series of biochemical reactions involving clotting factors in the blood, and the coagulation cascade forms a substance called fibrin. Now, fibrin strands weave through the platelet plug, and it forms a really stable and robust clot that effectively seals the wound. So think of the platelet plug acting like bricks, and think of fibrin that acts like mortar. And together they form a really, really stable clot. Then finally in our hemostasis stage is clot formation. So that fibrin mesh along with the platelets transform the existing platelet clot into a solid fibrin clot, and the clot stops further bleeding. This clot is going to act like a barrier. It prevents pathogens from entering in the wound. It provides a scaffolding for new tissue to grow. And over time, that clot will contract and bring the wound edges closer together, facilitating the next stages of healing. So our next stage of healing is our inflammatory stage. Now, this is the second phase in wound healing, and it begins immediately after the injury. So this stage is crucial to controlling bleeding and infection. The inflammation stage typically lasts for a few days, but it can be prolonged dependent if the wound is a lot larger or if it's become infected as well. It is a critical stage that sets the stage for the next few steps in the healing process by ensuring that the wound is clean and ready for new tissue formation. So after the initial vasoconstriction, so we're stopping that blood flow, we then get the blood vessels start to dilate. So we get vasodilation. And this is essential because it's going to allow cell nutrients to reach that wound site. This increased permeability causes fluid containing water and salt and proteins to leak into the surrounding tissue, which leads to that localized swelling, so that edema that we see when we've created a wound. We then see our white blood cells, particularly your neutrophils and your macrophages, migrate towards that wound site. Now, the neutrophils are your first responders, and they arrive within minutes to hours of that wound happening, and they ingest and destroy bacteria and debris through a process called phagocytosis. Then we see various chemical signals such as histamine, prostaglandins, and cytokines. They're all released at that site. And these mediators cause blood flow to the area, causing that redness and heat. And they also attract more immune cells to that site. Your macrophages, which arrive after the neutrophils, also continue with that cleanup process by eating up or engulfing dead cells, bacteria, and other debris. And they also release growth factors into the area. So this is there to promote tissue repair and to attract other necessary cells. And the accumulation of that fluid, those immune cells, all forms a substance called exudate. Now, this appearance can appear as pus, which is a sign that the body is actively fighting the infection and cleaning the wound. So as gross as it can be, it is a good thing. The classic signs of the inflammation include redness, heat, swelling, pain, and a little bit of loss of function as well. These symptoms result really from that increased blood flow, that fluid accumulation, and the activity of all those immune cells.
During the proliferation phase,
I shouldn't have music on that.
The granulation tissue.
Technical glitch there. We then have our, and now we've jumped a page. Oh dear, technology, hey? We now have our proliferation stage. So we've had our homeostasis stage, we've had our inflammatory stage, now we're into proliferation. Now, this is the third phase of wound healing, and it is crucial to rebuild the wound and new tissue. Typically, this stage starts from about day 3 and goes for about 3 weeks or so after the injury. So this phase begins with the formation of granulation tissue, which is a new connective tissue and microscopic blood vessels that form on the surface of a wound during the healing process. That granulation tissue is usually pink or red, and it has a really grainy sort of appearance, and it fills up that wound and provides a foundation for new tissue formation. New blood vessels form from existing ones to start supplying the wound with oxygen and nutrients, and this process is known as angiogenesis. The new blood vessels are essential for delivering necessary nutrients and oxygen to the healing tissue site. Fibroblasts, which are the cells that produce that collagen and other extracellular matrix components, migrate towards that wound site, and they synthesize collagen, which provides the strength and the structure to the new tissue. Now, collagen deposit is critical for wound strength and integrity. We have special fibroblast cells in here at this particular point called myofibroblasts, and they have properties of both fibroblasts and smooth muscle cells. They are able to pull the edges of the wound together, and this contraction and pulling together of those myofibroblasts reduce the wound size and helps to start closing up that wound. The final part of your proliferation is the epithelial cells start to migrate across that wound bed. So this is called reepitheliation. and start to cover it. And these cells start to form a new layer of skin over the granulation tissue and completing that wound closure. Then last of all, we have our remodeling stage or our maturation stage. So you'll hear different names for it. This is crucial for restoring the wound to its original strength and function. And this phase can last from several months up to even years. And that's dependent on the wound severity and the location of the wound as well. So some key stages that we see in the remodeling stage is collagen remodeling. So initially our wound is filled with type 3 collagen, which is gradually replaced with our stronger type 1 collagen. The collagen fibers start to reorganize and they start to cross-link into that basket weave sort of design, and they align along the lines of tension of the wound, which increases strength and flexibility to that wound. The new tissue formed is known as scar tissue, and over time, this tissue becomes more flexible and stronger. And the scar may initially appear red and raised, but it will eventually and gradually become paler and flatter as the remodeling process progresses. Cells that are no longer needed in the area, such as the fibroblasts and the myofibroblasts, go through a programmed cell death, and your extracellular matrix continuously remodels to support that new tissue in that area. The wound gradually will reduce. I was going to say increase, but our wound will gradually reduce in size as the tissue contracts and strengthens. So that, in a nutshell, is how wound healing or wounds happen and what happens when we create a wound or a wound happens to us. Now, there's several different factors that can influence the healing process of wounds. And we'll go through some key ones. They're not going to be every single reason, but some really key ones that we see. So age is a big one. Older individuals often experience a lot slower wound healing, and this is due to the reduced elasticity of the skin, but also they have a slower cell turnover as well. We know that everything starts to slow down as we age, so it makes sense for wounds to heal a lot slower too. Overall skin health, so conditions like diabetes, cardiovascular disease, immune disorders can also impair healing. Someone's nutritional status can also affect wound healing. So making sure that they have adequate nutrition, especially proteins, vitamins, and minerals that are crucial for wound repair. Genetics is also another one that can affect your wound healing. So some people are genetically predisposed for a longer wound healing response, and some have a faster or just a standard wound healing response as well. If there's an infection present, the presence of bacteria or other sort of pathogens can delay wound healing and lead to complications. There's medication that can affect wound healing. So certain medications such as steroids and say maybe chemo drugs can impede the healing process. Lifestyle choices such as smoking, excessive alcohol consumption, they can also negatively affect the blood flow and the oxygen delivery to the wound, which in turn is going to hinder that wound healing response. Other factors such as blood supply, is there adequate blood flow to the area, keeping the wound moist, which will promote faster healing. Temperature, so optimum temperature. So you don't want to be overly hot or overly cold. You want normal temperature as much as you can, because that's also going to help the body and all the bodily functions work at optimal levels. And then other things, even the pH level of the wound environment can affect the enzyme activity and bacterial growth. So we're going to get into why do different scars form, and also we're going to start getting into actual different scars and how to recognize them. Everyone who's on here, I'd really like to know Pop it down in the chat. What's the most common type of scar that you guys see in your clinic? If you share that with me, I always find it interesting. So why do different types of scars occur? Um, Various different reasons. Various scars can occur dependent on the depth and the size. So deeper and larger wounds are more likely to result in a more noticeable scar. The type of injury, so how they got that scar. So burns, surgical incisions, traumatic injuries can all lead to different types of scars. Genetic factors can actually play a key role in here as well. So some people have a family history of keloids or hypertrophic scars, and that can then increase the likelihood of developing these type of scars. Wound healing, so we want to make sure that we have proper wound healing protocols around, and keeping the wound clean and moist and protected will help to minimize the type of scar that we can get. The location of the body can cause different types of scars. So wounds in areas with more tension or more movement are likely to develop more hypertrophic scars. Thicker skin areas may scar differently in comparison to thinner skin areas. And we did cover this before, but age as well. So older age is a little bit slower, but younger skin, you'll find that younger individuals tend to heal more quickly, but they can also produce a little bit more collagen. So that can then lead to hypertrophic and keloid scarring as well. Just having a little look in here. Lots of post-inflammatory, yep. And acne as well. Awesome. Yeah, they're a lot that I see as well. Now, different types of scars. I'm going to go through the main ones and then we're going to kind of go into acne because acne can then be further broken down into little subsections of scars. So, atrophic scars. These types of scars occur when the underlying structures supporting the skin, such as fat or muscle, are lost. And this loss often results from conditions like acne or chickenpox where the body doesn't produce enough collagen to repair the skin adequately. Now, the lack of collagen leads to that sunken or that pitted appearance, as if some of the inner layers of the skin are missing. These scars are typically smooth to touch, but they're indented. They range from color from skin colored to slightly darker or lighter than the surrounding skin. And these scars are most commonly found in areas with less fatty tissue. So we tend to see this more on the face. The sunken appearance of those atrophic scars make them look like little valleys or little pick holes in the skin. They are generally not painful, but their appearance can be quite distressing for those who have them. And the formation of those atrophic scars is often linked to inflammation. So like we said, occurring with acne or infections like chickenpox. Additional injuries that result in a loss of tissue under the skin can also lead to the development of these scars. Now, managing atrophic scars, we're going to go through professional treatments and modalities that we can do, but they can be challenging, but there's various different treatment options out there. Options include topical treatments, laser therapy, microneedling, all which work to stimulate collagen production and promote that skin healing. We then have our hypertrophic scars. Now, hypertrophic scars are when the body produces an excessive amount of collagen during that healing process. And this overproduction of collagen results in scars that are raised and thick. But unlike keloid scars, because these aren't keloids, unlike keloid scars, hypertrophic scars remain confined to the boundaries of the original wound. So these scars are initially appear pink or red, and they may fade over time. However, they often remain firm to touch and can be a little bit itchy and uncomfortable. These scars tend to be found in areas of lots of movement. So joints, where there's increased tension on the wound, it can also exacerbate that scar formation. Hypertrophic scars are usually, like we said, red or purple and raised above the normal skin, but still in that wound area. They typically form along the side of that wound after things like surgery or an injury. They can become flatter over time, but they can also remain discolored and raised for years. So again, managing hypertrophic scars involves various treatment options, all aimed at reducing the appearance and the discomfort. Treatments like silicone sheets, corticosteroid injections, laser therapy, or all different types of things that can help to flatten and soften that scar. Then we have keloid scars. Now, keloid scars are scars that result from an overacting healing response where the body continues and continues to produce collagen even after that wound is healed. Now, this excessive amount of collagen leads to the scars that are raised and they extend beyond its original boundaries. So, unlike hypertrophic, which stay in the boundaries of the scar, keloid scars extend beyond that boundary. They also can continue to grow over time, leading to larger and more pronounced scars. They can be painful and itchy, also adding to the discomfort of that scar. In terms of appearance, your keloids are typically very elevated. They can be red or dark in color. They form when the body, like we said, produces too much collagen. Now, genetic predisposition plays a significant role in the development of keloids, and it tends to be more common in individuals with your higher Fitzpatrick skin types, so your 3, 4, 5s, and 6s. Then we have contracture scars. Now, contracture scars form when the skin shrinks during the healing process. So this is a phenomenon that's often seen in burns. And this type of scar occurs because the skin and the underlying tissues contract as they heal, and they lead to a tightening effect. And this contraction can pull the skin in towards the site of injury and creates like a puckered appearance around the wound. Now, this process is the body's attempt to close the wound really, really quickly, but it can result in significant changes to the skin texture and flexibility as well. Now, your characteristics of your contracture scars is tightened skin. It can restrict movement, especially when these scars are formed over joints. The restriction can be particularly problematic as it may actually limit the range of motion and function of the affected area. The skin normally looks quite puckered and may feel tight. We then have stretch marks. So I think we all see a lot of stretch marks. I know I see them on myself. Now, stretch marks are also known as striate, and they occur when the skin is rapidly stretched, causing the underlying collagen fibers and elastin fibers to break. Now, this rapid stretching can happen due to various factors, such as rapid weight gain or loss, pregnancy, growth spurts during puberty, rapid muscle growth from bodybuilding, just to name a few. And it's the skin's inability to keep up with this rapid expansion, resulting in the formation of these distinctive marks. Now, in terms of appearance, stretch marks typically start as reddish or purplish lines and gradually fade to a lighter color, often white or silver. They can appear as long, thin streaks or scars on the skin that are usually a little bit sunken into the skin. Over time, that initial really vibrant color fades, but the texture and the visibility of the marks tend to remain. So it makes them a common cosmetic concern for many, many individuals. I know I used to see a lot of people coming in wanting to work on stretch marks. So acne scars can be categorized into several subtypes, and each of them have really distinctive characteristics. Now, the most common type of an acne scar are your atrophic scars, which are those sunken scars that which we talked about at the beginning. But within this category, we also have three main subtypes. So we have our ice pick scars, our boxcar scars, and our rolling scars. Now, our ice pick scars are deep and narrow, and I'm sure if you've seen acneic skins, you've seen these ones. They can go down, extending into the dermis almost. They are quite sharp and they have very well-defined edges. They are typically caused by quite severe acne that destroys that skin tissue. You then have your boxcar scars. Now, these, on the other hand, are quite broad and rectangular in depression with really steep edges, and they can have a smooth or a rough texture. These scars are often a result of inflammatory acne that destroys the collagen. And then lastly, in your atrophic acne scar is rolling scars. And these are really wide and shallow depressions on that skin's surface. They're smooth, they have sloping edges, and they give the skin a really kind of wavy and uneven texture. So they are all caused by damage beneath the skin's surface, creating that rolling sort of appearance. Then the last one here is our hypertrophic scars. So another type of acne scar that we see are characterized by that raised edge above the skin surface due to the excess collagen production during that healing process. These scars are normally quite thick and raised and firmed in comparison to the other scars. Now, I thought we would go through, before we go through the treatments, post-inflammatory erythema and post-inflammatory hyperpigmentation. Now, whilst these aren't, I guess, true scars, they are commonly associated and a common result of acne and can be mistaken for scarring at times. So your your post-inflammatory erythema, and your PIH, so your post-inflammatory hyperpigmentation, are two common skin conditions that occur after an inflammatory injury to the skin. So normally acne is when we see these. Now, post-inflammatory erythema is characterized by red or pink marks that result from the damage to the capillaries in the skin. And these marks are commonly in lighter skin-toned individuals, so your Fitzpatrick's 1 and 2, sometimes your 3. They can appear as red, pink, or purple spots depending on the severity of the inflammation. PI is often seen after acne lesions heal and can also be accompanied by mild discomfort and a little bit of itching too. On the other hand, your post-inflammatory hyperpigmentation, so your PAH, is characterized by darkened patches of the skin that occur when the skin produces excess melanin. And this is in response to inflammation or injury. So the condition is more common in your individuals with the darker skin tones. So your Fitzpatrick skin types 4, 5, and 6 is where we more commonly see this. I'm not saying that Fitzes 1, 2, and 3 can't get PIH, but we just see it more commonly in those higher Fitzes. And they present as brown, gray, and black marks on the skin. PIH can result from various different skin injuries, including acne, eczema, psoriasis, and they tend to persist a little bit longer than your post-inflammatory erythema. The darker spots can actually become more pronounced with sun exposure, making sun protection a really, really important and crucial part when you're managing PIH. Now, both PIE and PIH are caused by the skin's natural response to trauma. PIE results from the dilation and damage of blood vessels, while PIH is due to an increase of melanin production. So let's get into our professional treatments for scarrings. So we're going to go through some modalities and look at some incredible before and afters. I love a good before and after. So first of all is our LED. So LED therapy, and in particular, I am talking here about using red at 633 nanometers and near infrared at 830 nanometers. These are an effective way to treat scars due to its ability to enhance cellular energy production. So the mitochondria in our cells, known as the powerhouse or the power plant of our cells, produces adenosine triphosphate or ATP, which is absolutely essential for cellular function and wound healing. We need it. Now, when red and near infrared light are absorbed by the mitochondria, and specifically by a component in the mitochondria called cytochrome C oxidase, it triggers a process that converts the light energy into chemical energy. And this conversion boosts those ATP productions, then providing the cells with energy needed for tissue repair and regeneration. So this increase in ATP production is particularly beneficial for activating your fibroblasts. So the cells that are going to help produce collagen and your extracellular matrix components, and is crucial for wound healing. So by stimulating those fibroblasts, the red and the near infrared light in your LED promotes the formation of new healthy tissue, which can reduce the appearance of scars. So this process is not only to accelerate wound healing, but also improves overall skin texture and appearance of the wound, making the scars less noticeable over time. So LED therapy is incredible, and I believe that everybody should have an LED device and should be utilized all the time. We can use it for various indications, such as skin trauma like wounds, burns, sunburn, post-surgical scars, red scars, and it's the ability of that red and near infrared to really penetrate deep into the skin to promote that healing from within. I love LED, if you cannot tell. Now, this is an incredible before and after. Our client here had one Dermalux LED treatment prior to surgery with near infrared and red to prime that mitochondria to get him to start producing more ATP. Then after the surgery and once the patch has been removed, we've had them under 2 to 3 times a week using near infrared. So they've had 9 sessions afterwards to help promote that healing. That is absolutely incredible. Another one here, this client has had 6 30-minute combined red and near infrared treatments in 30 days. Again, absolutely mind-blowing. While our skin is incredible and can heal really well, additionally, putting in that LED is the best thing. So you've got LED. Another thing that's really effective treatment for reducing the appearance of scars, and particularly acne scars, is by using chemical peel solutions or enzymatic peel solutions over the top of the skin to remove those top layers of the skin and really help with that new skin growth. So this process begins with the exfoliation of the outer skin layers, where the chemical solution causes the damaged skin cells to peel off, revealing that fresher, healthier skin underneath. And this exfoliation is going to help to remove superficial scars and improve overall texture to the skin, making it appear more smoother and more even. In addition to exfoliation, chemical peels also stimulate collagen production, which we know is a crucial protein to keep the skin firm and smooth, and increased collagen production can also help to fill those atrophic scars, which are those depressed scars caused by a loss of tissue. Now, again, we've got some brilliant before and after of our image acid peels here. We've had with this client, they've used their acne lift, and this is a series of 6 on both of these clients. Again, absolutely incredible. It's not only helped to kill the bacteria in there, but it has helped to soften up the skin, smooth out that texture as well, and eradicate those scars. So I would be over the moon. And I know we see a lot of acne scarring, and acne scarring can be quite detrimental to the client that's got it as well. So it's always so nice to have that ability to help our clients. Next is our collagen induction therapy or our skin needling, whatever you want to call it. Microneedling, lots of different names, but it's collagen induction therapy. And this is a really, really effective treatment for treating various different types of scars. So acne, atrophic, hypertrophic scars. And the process involves using fine needles on a pen to break down existing fibrous tissue whilst simultaneously stimulating the production of new healthy collagen and elastin. And as a result, we get flexible and softer tissue formation, gradually making those scars shallower and less noticeable each treatment. So one of the really key benefits of collagen induction therapy is the ability to enhance cell proliferation and regeneration. And by creating controlled tiny microscopic wounds or micro injuries, the skin's able to naturally go through its healing process, and that's activated, and it's going to lead to faster and more effective repair. So it's not only going to help with existing scar tissue, but it also lowers the risk for future scarring as well. Now, as the controlled wound created by the microneedling ensures the skin heals properly, it promotes a smoother texture and a more even skin tone as well. It also promotes the growth of new blood vessels, which is going to increase nutrient flow to the area and improve oxygenation to the treated areas. And that enhanced blood flow overall supports healthy skin and aids in healing. Sorry, I lost my train of thought there. So absolutely incredible. Now, this is a great before and after because it's not always the face we're working on. There is the body as well. So this is stretch marks and a scar. So this client has had 5 microneedling or collagen induction therapy treatments. And again, you can see the stretch marks are slowly fading and even that scar above the belly button as well. This is a brilliant before and after. So this is a zoom in of my next picture here. So this poor client had quite intense acneic scarring, and this is after 6 microneedling treatments. And again, we can see a lot of that boxcar scarring has really softened up. We're creating a bit more collagen to plump that up in that area. Another one that we can use is radiofrequency assisted microneedling. So this is a minimally invasive cosmetic procedure that combines your traditional collagen induction therapy along with radiofrequency energy. And the process involves using a device that's got tiny needles or pins or electrodes on the end, and it creates a controlled micro wound into the skin. As these electrodes or needles penetrate into the skin, they simultaneously deliver radio frequency energy into the deeper layers as well. So this combination of mechanical needling and thermal energy causes the microablations on the skin surface, promoting skin regeneration and collagen production as well. So the primary benefit of your RF-assisted microneedling is its ability to improve skin texture and reduce various skin imperfections by stimulating collagen and elastin. The treatment's going to help to smooth out fine lines and wrinkles, making the appearance firmer and more youthful. Here we have before and after 3 treatments using radiofrequency assisted microneedling on acne scars. And again, this is after 4 RF-assisted microneedling treatments as well. We can see pore dilation has really come in. We can see those scarrings, those rolling scars have really softened up. Then last of all in our modalities is our ablative laser or ablative fractionated laser. So these are really powerful tools in the treatment of various different scarrings, acne, atrophic, hypertrophic, surgical. And these lasers work by creating tiny microspots of ablation in the epidermis, and it produces inflammation and heat. And this heat then spreads into the dermis, and that stimulates the fibroblasts and it initiates the wound healing response. As the skin heals from these tiny little micro injuries, the tissue and collagen stimulation occur, and this results to a really dramatic skin renewal. This process is going to help to smooth out uneven skin areas, reduce congestion, promote the formation of collagen, and result in a really more natural looking rejuvenated texture. You have a few different lasers out here, and again, this isn't everything, but we've got our pulse dye lasers, which are particularly effective for treating red and pink scars and hypertrophic scars. And these lasers tend to target the blood vessels within the scar, reducing the redness and flattening those raised scars. You then have your fractionated lasers, which are best for atrophic scars or indented scars. So those caused by acne. So your CO2 lasers are really good. And then similarly, your erbium YAG lasers as well. They remove the outer layers of the skin with minimal heat damage to the surrounding tissue. So they ablate a little micro injury, but leave healthy tissue around the outside, which means that we're able to stimulate collagen production and really enhance that skin texture as well. So it really leads to a more refined and softer appearance. Now, this is before and after 3 treatments using an erbium YAG. And again, this is another before and after. This is 4 treatments using an erbium YAG. And this client had more of the atrophic scars, almost the ice pick scars there. Now, one thing I will say is you've got all these incredible modalities. It's often that we will need to use multiple modalities, not just one is going to suit every scar, and often we need to do a few. So for instance here, this client's got ice pick scars, and we've used our erbium YAG laser to really soften that up. But we still have a few really deep ice pick scars there. So that's when I would be opting for microneedling, because I really can customize that needle to go nice and deep and focus on those particular spots there where those ice pick scars are still prominent. So always think about combining. LED should just be always there, but then you've got all your other modalities, and a multi-prong approach is always going to yield the best results for you. So we've got our professional modalities, then there's ingredients that are going to help to target and support treating scars, and something that we want our clients to be using on a regular basis. So things like silicone sheets or silicone gels, which help to form a really protective barrier over the scar. They help to maintain moisture and protect the wound. You've got retinoids, retinols, tretinoin, all of those different types of vitamins A's, which are antioxidants and also help to increase cellular turnover. Vitamin C, another extremely powerful antioxidant, but also is going to help to brighten the skin, reduce hyperpigmentation, but also we know that it supports and promotes collagen synthesis too, which is what we want for the most part with scars. Allantoin provides moisture and helps to soften the skin, so it's going to promote that healing, reducing the appearance of scars. Hyaluronic acid is another brilliant one to help hydrate the skin, help it remain plump. Salicylic acid and glycolic acid in particular with your AHAs and BHAs, helping to exfoliate the skin. Salicylic is going to help to unclog the pores, and then your glycolic is actually going to help to exfoliate and increase that cell turnover. And then lastly, you've got azelaic acid, which helps to reduce inflammation and hyperpigmentation. So not a finite list, but a good start. So start thinking about your professional products that you have and what you can get your clients on to constantly feed their skin at home. So what I will say is consistency is key. We can't just do this for a week and stop doing it. When you're treating scars, you need to preface it with you and I are going on a journey. We are going to make a huge, incredible difference, but it is going to take time, and consistency is key. So silicone gels and sheets, typically we can see results within about 4 to 8 weeks of consistent use. Things like our retinols can take 3 to 6 months to start seeing significant improvements. So constantly feeding the skin. With vitamin C, we tend to see results within about 8 to 12 weeks of continual use. Allantoin can be seen within a few weeks to a couple of months. Hyaluronic acid can be immediately, up to a couple of months as well. UVA and UVB protection is important and my completely non-negotiable. If I'm treating scarring, you have to be on an SPF. It needs to be there. Our wound collagen is really fragile and prone to breaking down from UV damage. Plus, if we're also got PAH in there, it has to be on there to help to control and minimize any sort of damage to the skin. AHAs and BHAs can be seen on regular use within a few weeks to 6 weeks. And things like azelaic acid between 4 to 12 weeks of regular use. So consistency is key, continual use is key. For all the treatments, consistency. You're going to get sick of me saying that, but consistency is key. Regular application as directed, and make sure you let your clients know what they need to do. So this is a question that I get asked a lot is when can I treat a scar? So the timing for starting scar treatment is crucial, and it's going to depend on the type of scar and the severity of the scar, as well as the chosen treatment methods. It's best to wait until the wound has closed, so fully healed, before starting any sort of scar treatment. So this can take anywhere from a few weeks to a few months. But things like topical silicone gels or creams, they can be started once that wound has been closed up. On the other hand, more intensive treatments such as your microneedling, your laser, we're looking more around that 6-ish month post injury. LED is probably the one thing that we can start pretty much immediately on near infrared only, so not red at this stage. So if you've had someone, particularly, we get asked this about surgical scars. Once the dressing has been removed, because there's no point doing an LED treatment with a dressing because those light waves won't be able to penetrate. Once that dressing has been removed, you can use, and in particular, our Dermalux Flex and our Dermalux LED has medical certification that we can treat wounds. So you know that it's really going to work, and it is incredible. So we can start our near infrared treatments with our LED as soon as that dressing's been removed. And I would be getting my client in every second day and just hitting them with that near infrared on a constant to help with that ATP and with that wound healing. Once the wound is then closed up, We're looking at about 3 weeks to 3 months. We can start looking at the silicone patches, keeping it nice and moist. Once the wound has closed and shows no sign of infection, topical skincare can start coming in there. And then about 3 to 6 months post-treatment, we can start getting our microneedling, our peels, our laser, our RF-assisted microneedling in there. And then about a year after, we can start getting things like injectables. So some people, after doing all that we can for them, will go in and get a little bit of filler put under the atrophic scars to kind of plump it out. Or we can get surgical revision, which is really great for those deeper pucked ones that we can't soften up. Now, patience is also key here. So most scars are going to take about 12 to 18 months to fully mature. So it's really important to be patient and consistent. Alrighty, everyone. So that brings us to the end of today. Thank you all so much for joining me. If there are any questions, pop them in. I know there was a lot of information on today's webinar, but I do hope that you found it really, really useful. I really find it interesting how wounds happen, how they heal, and how scars happen as well, because we see it a lot in our line of work. What I would like to say is please join us next month. So next, what is that, November? Goodness me, it'll be November. So next November, the first Tuesday in November, at 10 a.m. And we will be going through our next Tuesdays at 10. If you jump onto the Professional Beauty website, you will find the subject on there and where you can register as well. But apart from that, I hope that you all have an absolutely fabulous day. Any questions, please reach out. If not, we will see you next month. Take care, everyone.